Vulval cancer is a rare type of cancer that develops in the external genitalia, vulva, which includes the outer part of the female genitalia, such as the labia, clitoris, and the opening of the vagina. It typically affects older women, but it can occur at any age. Early diagnosis and treatment are crucial for better outcomes. Causes and risk factors. The exact cause of vulval cancer is not fully understood, but certain risk factors can increase the likelihood of developing it. 1. Human papillomavirus, HPV, infection. Persistent infection with high-risk strains of HPV, a sexually transmitted infection, is a major risk factor. 2. Age. Most cases occur in women over the age of 60. 3. Vulvar intraepithelial neoplasia, VIN, a precancerous condition where abnormal cells are found in the vulva. 4. Weakened immune system. Conditions like HIV or medications that suppress the immune system can increase the risk. 5. Chronic inflammation or skin conditions. Conditions like lichen sclerosus or lichen planus can lead to scarring and inflammation, increasing the risk. 6. Smoking. Smoking weakens the immune system's ability to fight off HPV infection. 7. History of cervical cancer or dysplasia. Women with a history of these conditions are at higher risk. Symptoms. The symptoms of vulval cancer may vary, but often include persistent itching, one of the most common early signs. Lumps or ulcers, a growth, lump, or sore on the vulva that does not heal. Pain or discomfort, especially during urination or sexual activity. Bleeding, unusual bleeding not related to menstruation. Thickened or discolored patches of skin. The skin may appear red, white, or darkened. Swollen lymph nodes, usually in the groin area if cancer has spread. Burning or tingling sensation. Diagnosis. If vulval cancer is suspected, the following steps may be taken to confirm the diagnosis. 1. Medical history and physical exam. A detailed review of symptoms and risk factors. Examination of the vulva for visible abnormalities. 2. Biopsy. A small sample of tissue is taken from the affected area and examined under a microscope. 3. Imaging tests. CT, MRI, or PET scans may be used to determine the extent of the disease, or if it has spread to other areas. 4. Colposcopy. A magnified view of the vulva to closely examine abnormal areas. Stages of vulval cancer. Vulval cancer is staged based on how far it has spread. Stage 0. Abnormal cells are confined to the surface layer of the skin, also called carcinoma in situ or VIN. Stage I. Cancer is limited to the vulva or perineum. Stage 2. Cancer has spread to nearby tissues like the lower urethra or vagina. Stage 3. Cancer has spread to nearby lymph nodes. Stage 4. Cancer has spread to distant organs, such as the bladder, rectum, or beyond. Treatment. Treatment depends on the stage and type of vulval cancer and may include 1. Surgery. Wide local excision, removal of the cancer and some surrounding healthy tissue. Vulvectomy, partial or complete removal of the vulva. Lymphadenectomy, removal of lymph nodes in the groin to check for spread. 2. Radiation therapy. High-energy rays are used to destroy cancer cells, often combined with surgery or chemotherapy. 3. Chemotherapy. Drugs are used to kill cancer cells, especially in advanced stages or when surgery isn't an option. 4. Targeted therapy. Specific drugs may be used to target cancer cells if certain mutations are present. 5. Palliative care. Focuses on relieving symptoms and improving quality of life for advanced cases. Prognosis. The prognosis for vulval cancer depends on stage of diagnosis. Early detection greatly improves survival rates. Type of cancer. Squamous cell carcinoma, the most common type, generally has a better outlook than rarer types like melanoma. Response to treatment. Prevention. While vulval cancer cannot always be prevented, the following steps may reduce the risk. HPV vaccination protects against the strains of HPV most associated with vulval cancer. Regular gynecological checkups. Early detection of precancerous conditions like VIN. Quit smoking improves overall immune health. Safe sexual practices reduces the risk of HPV infection. Monitoring chronic skin conditions, managing lichen sclerosis or other vulval disorders under a doctor's care. If you notice persistent itching, pain, or any unusual changes in the vulva, consult a healthcare provider promptly for evaluation. Early detection is key to successful treatment.